Hello, this is David Ritchie, and today I'm going to be talking to you about 10 steps to stop the spread of COVID-19. And we're going to start today by talking about how you can first maintain your personal physical health. Basically, this is categorized as what you can do to make sure that you are going to continue to be a healthy individual during this crisis. So the first step that the CDC recommends is to self-quarantine. This basically means that you are maintaining a social distance from everyone else in your life except those that are most important to you. Only being around the people that are most important to you, such as if you're a husband or wife, just your spouse, or if you have children, just your children, making sure that those are the only people in your life that you can spread the coronavirus to is going to help reduce the number of cases. If we can reduce the total number of cases, we're also going to limit the number of people going into every single hospital. If hospitals aren't flooded with people who have the coronavirus, they're able to treat more people and treat them with a higher quality of care. Self-quarantine is important not just to stop the spread of the virus, but to also limit the amount of people that are going into our hospital systems. That brings us to step 2. How do we keep the virus out of your home? You have to keep yourself and your house as clean as possible. This isn't just taking simple actions like washing your hands. Desperate times call for desperate measures, and during this pandemic, one of the ways that you can do that is by making sure every item around you is as clean as possible. Obviously, with self-quarantining, if you aren't going into society and interacting with other people, you aren't going to get other people's germs. However, I do understand that at the same time, you are going to have interaction with the outside world in some capacity, whether that's, say, a grocery man coming with your groceries to your door. Making sure that you keep everything clean by doing tasks such as cleaning your house with Clorox wipes or hanging your clothes up after you've worn them in public and interacted with other people, or even washing your groceries before you eat them can make sure that you aren't coming into contact with this virus. Basically, the goal is to take every precaution possible to make sure that everything in your house is clean. The third step is use equipment when instructed. The key word here is being when instructed and when instructed only. According to the World Journal, this is a Chinese source, basically what happens is if you don't listen to medical professionals on when to use this equipment, you can actually put yourself at more risk. For example, the CDC published a study a few weeks ago that said if you are wearing masks in public, you can potentially put yourself at more risk for getting the coronavirus if you wear the mask wrong. However, the CDC has then since modified that and now recommended to wear masks. Not necessarily wearing gloves, but wear masks as well. One of the more important things is to listen to your medical professionals, and if they say use equipment if you're going out into public, then use this equipment. If they say don't use this particular piece of equipment, do not use that particular piece of equipment. These medical professionals have a ton of research backing this up. They know what's best for you. They know what types of equipment you need to be using. So use the equipment when instructed. And our fourth and final step, if you develop symptoms, consult medical professionals. The other key word here being if you develop symptoms. If you have a mild cough or a mild fever, yes, absolutely consult your medical professionals. However, if your medical professionals advise you not to go into a hospital, it's probably for your own good. It's either because they don't want other people to be exposed to the particular virus you have, even if that's coronavirus, or they don't want you to be exposed to other people's germs by going into a hospital. Once again, trust the medical professionals. If they say go into a hospital to get this treated or go to the doctor's office, then go. If they say stay at home and drink ginger ale and take Advil and keep yourself hydrated, then do that. Ultimately, you want to consult your medical professionals before making any type of decision if you do develop symptoms. The next thing I want to talk about is how to maintain strong mental health, because obviously maintaining physical health during this crisis is really important. However, because you are socially isolated, in most cases also self-quarantined, you're not going to be interacting with as many people and having that same type of social interaction that you're used to. So in this time, making sure that you're taking strong steps to make sure you have a good mental health is also of the utmost importance. And the first way we can do that is by remaining social with friends and family. Social distancing does not mean you can stop talking to people on your phone or use your technology to your advantage. Make sure that if you have social media, you're using that as an outlet to communicate with other people. And even though it's not going to be the same as having physical face-to-face human interaction, make sure that you're doing that. Dr. Catherine Pont also brilliantly pointed this out and said that during this crisis, that mental health cases with people that are struggling with mental health have gone drastically up. However, one of the things that we can do is just continue to maintain some type of social interaction, whether that be via Zoom or FaceTime or other social media platforms, and making sure that even though these are great resources, you're using them for the right reasons. Not just using them to browse Instagram and browse Twitter, but ultimately using them to have meaningful connections with other people. The next thing that you can do is maintain a daily schedule. One of the things that people have found most troubling during this crisis of self-quarantining is that they find themselves falling into schedules which are ultimately not what they're used to. Most people that are working are used to a schedule in which they get up early in the morning, they get ready to go to work, they come home, and then they go to sleep. However, because we're constantly at home, we might not have as many things to do. One of the other things that Dr. Catherine Pont pointed out is that most people that are not maintaining a daily schedule or have things to do during this crisis are often finding themselves in very unfortunate mental health situations. Find things to do around your house. Find projects to do. Get up at a certain time every day to ensure that you have a daily schedule. Taking these steps are going to make sure that you have a strong mental state so that when you do go back into the real world, you are not only used to having a daily schedule, but you're ultimately going to be a happier person because you decided to go and follow through with that. And finally, one of the last things you can do is maintain strong physical shape. Research before the coronavirus has proven time and time again that when people are working out and exercising, it releases endorphins into the body, which ultimately makes people happier and have stronger mental health. However, because the coronavirus has limited people's ability to go out in the world and, say, engage in their normal activities, especially individuals in school who are not able to engage in their sports like they're used to, this has created a situation in which some people that are usually being physically active aren't as physically active anymore, and thus their mental health is going to go down with that. Making sure that you maintain strong physical shape by maybe going on YouTube and looking up videos about how to work out inside your house, or going outside and taking a walk, making sure not to come into contact with other people or take a bike ride in a similar manner, is going to help you maintain a stronger mental health. Finally, I would like to talk to you about economic and social health. So this falls under the category of what can we do to make sure that our government and our systems in place for work continue to function at a high level during this crisis and after this crisis as well. So the first thing that we can do is continue to work. So this is from a reference, China Daily, and they talked about why continuing to work through this crisis, finding ways to work at home is not only important for the mental health, but society functioning after this crisis is over. Basically, they talked about how in Wuhan, people continued to work, and basically after the crisis was over in that particular region, they were able to return to work, and the economy, because people had continued to work, didn't crash as much as it would have if people stopped working altogether. So finding ways to work from home is not just a social duty to make sure that your country continues to function at a high level, but also it's going to help, going back to the idea of mental health, you continue to have a daily schedule, feel better about yourself, and feel like you have a purpose in life while you're at home, either alone or with your family, with not much else to do. And the last two steps are kind of together. This is one of the most important steps, is to trust your medical professionals. This goes to pretty much anything that you can possibly think of. You want to take the advice not of yourself and not of what the media is telling you, but reputable medical professionals. What are they telling you you should do? So going back to the example of personal protective equipment, if they tell you that you should not wear this particular piece of equipment, do not wear it. If they tell you to do not go get a test for a coronavirus because we don't think you have it, do not go get a test for a coronavirus because you're putting yourself and other people at risk. If you don't trust the advice of medical professionals surrounding all the things that they are telling us basically to do, it's going to create a situation where there's a higher chance of the coronavirus spreading. You might not agree with what they're saying, but at the same time, these medical professionals have put in countless hours of research and work to make sure that what they are saying is accurate. So trust them, believe in what they're doing, and you will help to stop the spread of coronavirus. And lastly, this kind of goes with the last step, do not be the exception during this crisis, otherwise known as do not be the person that is disregarding the law or disregarding what medical professionals are telling you to do because you believe they are wrong or because you believe that it won't make a drastic impact. The reason that the governments all across the world, in fact, as well as medical professionals are giving you this advice is because they know what needs to be done in order to stop the spread of coronavirus. Do not be the person that disregards those because you think it's not going to have an impact. If you have a mentality that's like, if I go into society and I'm the only one going into society, then nothing's going to happen. That's simply not the truth. There are plenty of people in low-income situations that have to go out because they're in a situation which, say, prevents them from getting grocery deliveries because it's too expensive. They are the ones that need to go out in the public. They are the ones that cannot fully socially distance. And we need to make sure that not only do they have a space to do so and feel comfortable that no other people that need to be out are going to be out, but also by keeping yourself isolated and removed from that situation where you have to go out, you are making sure that you stay safe, your family stay safe, and thus your friends stay safe. So do not be the exception. Make sure that you're following the advice of medical professionals, and do not think just because if I do something that it's not going to have a big impact, because it will. Every person that plays a part in this crisis is extremely important. Lastly, thank you so much for watching. If you want to check out any of the references I used, please feel free to do so. They are all linked right here. Thank you so much and have a wonderful day.